Dr. Suzanne Gilbert Lenz, welcome to the American Glutton Podcast.
Hello.
So I have 4 daughters and a wife.
Okay.
And so I think what we're going to talk about is very interesting to me. Number one, because I have no knowledge or like my wife, I know a lot about dieting and exercise and stuff like that, but my wife will come to me and ask me questions about like, well, how does this apply to a girl? And I always say, I have no idea. I think it is very different. Like your hormones are different from mine, and what might be appropriate to you might not be appropriate for me. So I'm so excited to talk to you about all these things.
Great. And I mean, unfortunately, my answer might be, we don't know.
Sure. Yeah, that's fair too.
Yeah. It's which is part of the conversation, honestly, because it's very frustrating that we don't know. So I'm gonna let you ask me the questions, but the big overarching issue here is we should know.
Okay.
We should know. Why don't we know? I think you and I could probably both answer why we don't know. We haven't really put our attention to it. And it's great that you have that conversation going in your own family and in your home, because it does get frustrating. You know?
Are you saying we don't know? Like when you say we don't know, I go into like, yeah, man, there's so much about the human body we don't know. Are you saying specifically about women?
Yeah.
Oh, okay.
Right. Because I think if you look at, I mean, I feel like this is what I like about podcast, the conversation. The problem here is that a lot of the data on diets, and I mean, you and I can discuss the word diet, but we're just as a catch-all right now, on habits, they're often not looked at with women. And I think a lot of the most popular methodologies, fads, whatever you want to call it, that leak out into the public are definitely, I mean, especially intermittent fasting, unfortunately, and keto, and I have a lot to say about keto.
I do too. I can't wait to talk to you about keto.
I mean, and let me just say, I'm an OB-GYN, okay? I'm a gynecologist. I'm definitely an expert in menopause. I am not a nutritional expert, okay? That's not my area of expertise. I'm not a nutrition scientist. I'm not a food scientist, but I have enough experience personally and in 20 plus years of practice, and especially around menopause and perimenopause, where metabolic rates change, hormonal influence has an impact on the way our body shape changes, how we respond to both nutrition and exercise. But I'm not a nutritional scientist, so let me just say that. But I can tell you from writing this book and researching, the data has not been accrued from women, and then it goes out into Instagram or the social media or the ether, or even casually into medicine, and suggestions are made that don't work for women, and they feel like a failure. In the context of diet culture already, it's a disaster, and it's very unfair.
Yeah.
So when I say we don't know, that is specifically what I mean. And I say it's not okay that we don't know. That's not okay. There's literally no reason for it. All you got to do is study women.
Yeah. I get very, I come at diet from the lens of massive weight loss. So if there's a, I think there's many lenses people can approach diet, many perspectives or viewpoints that can be looked at diet. Like a guy who wants to lose 10 pounds, that's a person who validly is going to go and look at diets. And I think it's just very different from the point of view I take. And perhaps keto works for a guy who needs to lose 10 pounds. But if you're talking about hundreds of pounds, then it's not just a linear one stop fixes everything. You know what I mean? And so I imagine when you get to something like menopause, or, you could even have various points where you have to differentiate men and women, like prepubescent, postpubescent, and then for women, menopausal. And I don't know if men go through something similar to that. But for men, hormones change, certainly.
For sure. I mean, aging and hormones interact with each other. It's that's not my area, but I will tell you just the major difference, the age in men and women is that women have such a distinct cycle for a large portion of our lives,
Right.
that we actually identify a lot of times our bodies are that cycle. I mean, if you think about, you're going to maybe have, from the ages of 11 or 12 to 50 something, that's most of your life.
Yeah.
And so one of the things that I see happening is we identify that's our body. But also when you look specifically at lifestyle, at habits, at diet, at exercise, we know that this, we do know that women or people with those hormones and that cycle have a different response to changes that are made at different times in that cycle. Now you get this 2 to 10 year period of time, which we're fluffily calling perimenopause, which is like not a meaningful term, but it's the most immediate period of time leading up to menopause. I like to say, well, I mean, everything's leading to menopause. That's because I'm 56. So that's the way I look at it. Point of reference is everything. But so if we're talking about that sort of last 8 to 10 years, now those fluctuations are not as predictable and as regular. And this is where people really get frustrated because they're not responding the same way. And they're not even responding the same way that they were before. And maybe how they're responding for this 3 months isn't the way they're responding for the next 8 months. And it's not just in their head, and then they're getting information about how they should be doing it, how they could be doing it. And it's like, that information is not necessarily accurate. It's not reflective of the reality. And we're also dealing, and you would, I think, understand this as a person who went through massive weight loss, like the mindset and how you feel about yourself and what culture is telling you also plays a role. So it's really complicated.
Yeah, what you're saying would drive me up the wall because I've spent the last 20 years like figuring out stuff that works. And if you're saying like stuff that you figured out and you have this bedrock, this foundation, suddenly it's like that doesn't work anymore. You got to figure out something else. That would drive me really, really crazy.
It's hard. It's hard for people. I mean, I do think that the basic tenets of health and nutrition continue to apply, but just the fact that your fat redistributes, like that's also just like, it's uncomfortable. I can tell you from a personal perspective, it's uncomfortable.
Yeah.
And then you add on, like, you don't feel like yourself. What you did before isn't working the same way. And people can just feel really defeated by the whole thing. Or even like, I can just talk about my own personal experience. I mean, I don't even know where to start, but even if I just look at the last like 6 months, and now we're coming out of the pandemic, which didn't help anybody, by the way. And I do think that the amount of stress that we've been under in the last couple of years, I'd be interested to hear your perspective on this, but we know that cortisol has an impact on insulin resistance and metabolism, right? So I think then we have this baseline level of stress that got even higher, and that really affected people. And I'll tell you, the whole pandemic, I've had people coming to me saying like, is this COVID? Is it perimenopause? Like, what is happening?
Right.
So I can tell you 2.5 years in, now I'm like, okay, I don't know. So here's what I can tell you, I think may be helpful to you in terms of health. And I always try to focus on health. But my own experience has been that, like, I've actually really fairly, I wouldn't say radically, but I've really committed to some major lifestyle changes. And I'm not weighing myself because the number is not changing. Has not changed an iota.
Right.
And I just have to look at, how do I feel? What's my health? My shape has changed, actually, which is interesting. So, and I have the benefit of, my life partner is a longtime fitness pro. So he's supporting me.
Right. That's helpful. So you have somebody who can like program workouts and stuff.
Well, right. Or just like help me with eating. I mean, this is the first time we've ever done that, because I don't know how you guys roll, but like it's not really fun or sexy to have your partner telling you what to eat. And he doesn't want to have to tell me what to eat either. And that's just not fun. But he saw me being really frustrated by it, was just like what I was doing, which had worked before.
Yeah.
Wasn't working now. And the thing that you also know is it's not like, oh, quick fix, 10 pounds. It's lifestyle. It's sustainable. People ask me this all day, every day, Ethan. And I say to them, listen, What's the thing you will do? Do that.
Yeah. Yeah. No, I
You know?
agree. I mean, look, the reality is, these diets, you go on a diet, you're going to lose weight if you stick to it. I think for me, again, from the lens of massive weight loss, the problem I have with them is like, for instance, keto, like you're 500 pounds, you start eating only meat, you're losing a ton of weight in water, and then
Right.
and then you're losing a bunch of fat also. But then there's going to get to a point where whatever you were eating, you're now 100 pounds less. You still have 150, 200 pounds to lose. And you're not losing weight because you haven't reduced the amount of energy you're putting into your body again. And at this new size, you're now accustomed. And so it's like, guys, this is like as basic scientific stuff as you can get. Thermodynamics say that like there's a certain amount of energy you can put in your body, right? So that's my big problem with keto. And the other one is you're losing a lot of water, and most people are thinking of weight loss as a fat only thing. When I would get on the scale and think I'm losing weight, I'm thinking it's all fat. I'm not thinking I have multiple pounds of water stored in my muscles. So I can eat, 7,000 calories a day in ribeyes and still see a reduction on the scale because I'm losing all this liquid glycogen. So that's my, I think keto is it's just not giving the whole story. And then I think,
and it's also so inflammatory, which is a really huge problem that we have in our lifestyle and in the way that we eat. And anything that's going to increase inflammation long term is just bad. It's just bad for you.
right.
So I guess if there's a psychological benefit to get that going, okay, short term, but honestly, I'm looking at sort of longevity and long-term health impacts. And one of the things that I feel really strongly about and that I really advocate for in general and in my book is looking at the long view. And it's an interesting dynamic, right? Because I do want us to be able to be present, which is really hard to do, but also be thinking about the long term. And so when you look at the way you're living your life, what you're eating, hormones or not, that kind of stuff, I'm looking at reduction of risk long term for the big ones, which are cardiometabolic health.
Yeah.
The number one killer of women is not breast cancer. And I'm a breast cancer survivor. So I'm not here to be like, don't worry about breast cancer. I had breast cancer in my 40s. So, and I'm fine. But, cardiometabolic disease is what's going to kill you. That's the number one killer of people. 1 in 3 women are going to die of heart disease. So diabetes, heart disease, dementia, and Alzheimer's, women have 2 to 3 times the rate of their male cohorts of dementia and Alzheimer's. This is all inflammatory. I mean, it's not all inflammatory, but there's a baseline commonality here. Cancer as well. Inflammation is a necessary step in any of these diseases. If you're talking about packing yourself full of animal protein, oh my God, that's like just not good for you. Sorry. And I eat animals, okay? But I think we have to be thinking about more than just that number on the scale and what's happening in the next 6 months or 2 years. You got to be thinking about what's going on 20 years from now.
Yeah. Very quickly, and I'm sorry, just before I keep going back to it, I want to get into this in diet, and I want to get your advice for women. But you said perimenopausal. So I go back to my first, getting together with my wife and having to confront this thing that occurred regularly that altered our relationship, certainly. And then there was the this thing. Premenstrual would happen, then menstrual would happen. And there was a time period where I was like not writing down ticks on a calendar, but I was like, this whole cycle is all the time. This is not like a 2-day thing, 2 days a month or a week a month. This is like almost and then, I like said, like, I need to like really realize that something is happening and be more caring and interested in what's happening. And so we got into our rhythm. And then We wound up with 4 daughters. I also have a granddaughter. So there's just so many women.
You have a grandchild? What are you, like 10? What?
I'm quite old enough to have a but yes, she's 4 months old. We have a little
Oh,
granddaughter, and I've seen every iteration. I've seen irregular nothing burger periods to a kid who's now a teenager who is just like, regularly taken out of action, cannot
yeah,
function.
yeah,
But you said this word perimenopausal
yeah.
lasts from 2 to 12 years. And this was like a giant boulder that just fell on me. What does that mean?
That's a great question. I mean, the thing about it is that that term perimenopause is not defined. And excuse me, we have to kind of distinguish between the language that we use with each other as just human beings communicating and like medical terminology. I mean, perimenopause is not, it's not defined, which is why there's this wide berth. And I will tell you, I have like very mixed feelings about that. I've considered going on a campaign to banish the word because it doesn't mean anything. I think initially when we started using that term, and again, it's just the cushion, the time around or leading up to menopause. Okay, the average age of menopause is 51.4. Like what, like that's, like this is like data, right? That doesn't mean everybody's going to be done at 51.4, but the average age, right? So usually, and we consider normal menopause, and that's 12 months without a cycle, a period, consecutively for no other medical reason. So let's just that, see, that's very well defined, right? 45 to 50.
So once you've experienced 12 months, you're done. Menopause has happened.
Yeah, it's happened. As long as we know there's no other medical issue that caused it, right? Under 45 is considered younger, and it's considered what's called premature ovarian insufficiency, because this is coming from how the ovaries function to help initiate the response, the hormonal response that happens. It's a conversation between the brain and the ovaries. I mean, it's more than that, obviously. The uterus and other things are involved. Hormones are just chemical messengers, okay? They're just, insulin's a hormone, thyroid's a hormone. Hormones are going all over our bodies talking to each other. So we're talking about sort of a smaller subset, but they do talk to each other. And I'm bringing that up because we're going to recall that when we talk later about metabolism and why it has an impact. So we're just getting the definitions. Perimenopause isn't defined. I think what was started happening in the last 5 to 15 years, depending on who you're talking to, is that people started noticing that they were having a lot of symptoms that were unexplained, often dismissed, especially in women: achy joints, libido issues, changes in body, and in terms of like weight, metabolism, sleep issues, mood changes, so brain fog. And I think a lot of people have started to realize, oh, this may be in part related to the hormonal shifts and changes that are very subtle and then become less subtle and then become really obvious. So I think giving it a name and calling it perimenopause sort of empowered people and also helped them express their own agency around their body. The concern I have is that when you start to use a term a lot, then it's pathology. We're pathologizing a normal physiologic experience. So it's not to say that the normal physiologic experience, which is that your ovaries age out at some point, that's pre-programmed, that's going to happen. It's a blessing that you're still alive, right? But it's not to say it's fun or it's easy, but it's not a disease. So now we have a little bit of an issue, I think, in some quarters with this being used as a disease state that needs to be fixed.
Right.
As opposed to something that's uncomfortable, how do we support you?
Yeah.
I don't know. I really think the language is important. So I'm sure it is mind-blowing for you to hear that this can take a long look. There are people who report symptoms that I think could be consistent with perimenopause in their late 30s. And I'm not here to tell them it is or it isn't. I'm here, my job is to help you unwind it, figure it out, and what's the best path forward for you. That's my job. My job is to listen and to share my toolkit, which is deeper, wider, and a little more science-based, although not always, to get through it. That's my job. I'm not here to judge it. And that's not the way I see my role. I think I have colleagues who maybe feel a little bit differently, but that's the way I see it. And so I don't know if that helps a little bit, but it is mind-blowing, because especially for you as a man who's lived so intimately with people who menstruate, you really get a ringside view, and you're getting the ringside view of a variety of experiences, and it can really be it has a really big impact. And it's you know, I'm sorry about your one kid that has that many problems. Like, we should offline talk about that, because it shouldn't be that bad. Like, there's things we could do.
I mean, listen,
that's another podcast.
this kid is also the one who will like stub her toe and want to take the day off school. So, you know,
yes, I have one of those too.
I vacillate between like toughen up and between like, okay, look, she experiences these things with more volume than I do. Or maybe her sisters do.
Right.
And so while I'm not letting her stay home from school, I am being a little bit more delicate with her when that happens.
Well, that's the other thing I think that's really interesting too, is that, and I've just learned this as a doctor for 26 years, like, people experience their bodies really differently from each other. And it's we can empathize, and that's about it. Like we don't know how anybody else feels a feeling, which is kind of mind-blowing.
Yeah.
I mean, I'm getting far afield. So that's perimenopause. So perimenopause, what's happening physiologically is that there's sort of a slow decline in the amount of estrogen that's being produced in the ovary. I am simplifying this, but not just that. The other thing that the ovary does is it chooses an egg, which in a follicle, and then it releases the egg, ovulation. And then progesterone gets made. The hormone progesterone gets made in that part of the ovary. And then when you don't get pregnant, it starts to decrease and you get your period. You shed the lining of your uterus. Well,
I'm sorry, I have a dumb dude question.
No, ask.
So, and this is because, again, from the perspective of a guy, I know a bunch of guys, and I know there is total ability now for men to, you know, halt their changing hormones, or keep like whatever your hormones are at 19, you can have those till the day you die. For guys, is that a thing for girls?
Yeah, you can use menopausal hormone therapy. Absolutely. And I'm not saying people shouldn't.
Okay. I mean, I'm just curious, because I never, you don't see fucking, sorry for swearing.
Oh, I swear all the time. I just didn't swear first.
You don't see, now
I can.
Yes, anytime, for sure. This is, you know, you don't see, there's no television ads for chick hormones. Sorry,
oh
gal
my God,
hormones.
but there should be.
Right.
Well, okay, that's so interesting to me, because, you know, sometimes my perspective is so skewed because I like live in menopause land, and I have to remind myself that people are so under and uneducated about menopause, even the people who are going through it or who are going to go through it, which is why I wrote this goddamn book. Okay. So I'm so thrilled to share it with an audience that maybe is like, what? And their eyes are rolling into the back of their head, you know, like, guys. But you're right. We don't see ads for that. And I think we will. I think there's also, you know, it's not like, just like with men, I mean, male hormone replacement isn't for everybody. I mean, there are people who can do it, who can't do it. That's really not, we're not going to get into that too much unless you really want to.
No. It's just,
but I mean, absolutely menopause. But I'll tell you, it became controversial. There was a huge study published in 2002 called the Women's Health Initiative. It was honestly a very problematic at best study. Hundreds of thousands of women over a long period of time. The problem, and they looked at their use of hormones and the prevailing hormone therapy at the time, which is very different than what most of us use now. And, you know, mortality, medical issues that we're talking about, breast cancer, heart disease, stroke. The thing is that they didn't look at women in that transition, 40s to 50s. They looked at women average age 60 and above, and many of them already had heart disease. Well, guess what happened? A lot of people had heart attacks and strokes. And also people got breast cancer. And then it was like, oh my God, hormone replacement therapy is evil. And it's like, this study doesn't even apply to a 49-year-old who doesn't have heart disease. You know, it was not a good study. Some interesting things when they went back and looked at the data came out. Like, for instance, women who only needed estrogen and not progesterone. So remember, I told you the ovaries make estrogen the first half of the cycle, progesterone the second half of the cycle. They both start to decline as we age. They both have impacts on how we feel, our experience, weight, mood, all these weird symptoms that start racking up as you get into your 30s and 40s, and you're like, I feel like I'm going crazy. Well, it's because you were used to this and this, and now you're at that and that, and you feel different. And by the way, measuring these hormones isn't going to tell you anything about your symptoms.
Right.
So could we get more obscure and like there's no, like it makes you feel like, what do I do? How do I figure it out? Now we throw in this crazy study that makes you think you can't do it because it's going to kill you. But then they looked at the study and they looked at women who did not need to take progesterone because they had a hysterectomy, they didn't have a uterus. We're not going to go into all that, but they were just on estrogen. These women had less breast cancer. So this just goes to show you how complex these hormones are, how complex they interact with each other, with various tissues. Estrogen receptors exist all over brain, breast, not just uterus, ovaries, and the obvious vagina, you know.
And progesterone is only there?
Progesterone receptors you can have in other places too, but specifically estrogen receptors are everywhere, which means we know that estrogen will have an influence in various parts of our body and in various different ways, blood vessels. And then there's what kind of estrogen? Is it this form or that form? I mean, it's so interesting and complicated, and we're just barely touching the surface of what these changes can mean for us. And then how, this is my very long-winded way of answering that question, how to tailor the menopausal hormone therapy to the person. What is their issue? What can they tolerate? What is going to work best for them? It's not a one-size-fits-all thing. It's not a one-size-fits-all thing for guys either, but it is a little bit less complicated. It's sort of like testosterone, you know. And by the way, our testosterone, we have, you know, we make more we don't make as much testosterone as you guys, but we make more testosterone actually in our youth than any other hormone. Really? Testosterone loss is a big issue for us too, and especially when you start getting into lean body mass loss, which is one of the big issues for us with weight gain. Like we have to really work on really maintaining muscle mass or increasing it, which everybody does in order to maintain weight or lose weight. We also have the issue with bone loss. So, I mean, it's all like, I could go on and on and on. But
yeah, no, it's fascinating to me that women on average live longer than men, go through this crazy thing that is mostly about hormone changes.
Yeah.
And yet on TV, or, you know, I listen to a podcast, I hear of companies called HIMS, which are, right, you know, for male libido and male hormones, right, basically. Right. And I've never once heard of a company being advertised publicly about that for women. And I know a lot of women because I live with them, and I know they go through more hormonal stuff than any guy I know. So it's very curious to me.
Well, I mean, is it though? I mean, some of it is. So just so you know, HIMS has a division. It is HIMS and hers.
Oh, I didn't see. I've never heard of hers.
Because they don't advertise on ION.
Right.
You know what I mean? Or Annie or whatever the hell. I see that on all the time because we watch a lot of crime shows. So it's apparently we're like, you know, Murder, She Wrote. We're that, like, that's who we are now. But it's true, you don't see it. And, you know, that's, you know, as a side story, I was involved with a women's sexual health startup. I was the chief medical officer. I helped them get through their seed round. I ended up exiting. They're still doing it. And the difficulty that the founder, the original founder and CEO, had just getting meetings with venture capital. I mean, I think it's pretty well known that it's very hard for female founders to get funding. But now it was a female founder about a female, you know, sexual health problem was like every third rail you could possibly imagine. And she eventually did
really
get the money. Oh yeah, it was really rough. It was wild. They were like, is that a problem? I was like, who y'all fucking?
Like, I mean, listen, there's a lot of married people and people in relationships. I would think every guy in every one of those relationships would be rooting for that company.
It's going to change. It's starting to change. It'll change, but it takes these conversations. Right. We have to talk openly. It's funny to me. It's like if you are a cis hetero human, I don't like, so you're going to fix your erectile dysfunction, and where are you putting that penis? Like, if you're like, I mean, hello, it just doesn't even make any freaking sense. So
But I just didn't know. I didn't know it existed. I thought it was like, nope, we can't do it. They don't work on girls. This is not this is
oh
not
my
something
God,
that
I
can be
am
solved.
so happy to educate you on this.
It's
Yeah.
wild.
And since you're asking, I mean, if you talk about, I mean, sexual function, obviously in men and women is not an on-off switch, but with women, it's, well, I'll talk about women because that's my thing, right? It's libido. And also, as you know, look, it's a long-term relationship maybe, or you don't have a partner. I mean, there's libido is complex, but there is a hormonal impact with specifically testosterone loss and libido. And we have a great position paper from North American Menopause Society discussing that. We know that testosterone
In women, or
yes, testosterone replacement, it can be safely done with women. The FDA does not want to approve of this. Women's sexual health products have been brought to the FDA and had a very hard time being approved, including testosterone. So you need to actually go to a specialty pharmacy. It's insane, right? Okay, so we know that this is efficacious and safe in supervised and very specific ways. So there's libido, but then there's also the vagina needs to work. So if you've lost these hormones that I was talking about, and now you have tissue changes, so you have less blood flow, you have less collagen, you have less, even you could feel aroused and not lubricate well, or the tissue is very delicate and thin and gets injured easily. So you can and should use products, whether it's over-the-counter personal moisturizers. They're not all created equally. Some are amazing, some are terrible. There are vaginal hormones that you can use, and they're not systemically absorbed for the most part. They're just treating the tissue. There are energy-based devices like those that we've stolen, or I shouldn't say adopted, from cosmetics, lasers. Oh, sorry about that. Lasers and radio frequency devices that can help remodel that tissue. There are things you can do to restore your sex life, and they should be available to you. You should know about them. And I think this is great because anybody who's listening to this may now realize, oh my God, there's something I can do. There's something I can talk about my partner with, that I can help her understand that this doesn't have to just go away or be painful, or like, oh, I can fix my thing if I'm a guy, but if she's a woman, there's nothing she can do. That's not true.
right? This is
That's
also fascinating. I
oh my God,
cannot believe this isn't
so you're
being.
making my day.
I'm a guy who just ingests like pop culture stuff. This is not being pushed out there at all, from what I'm observing. And maybe it is. I do a lot of dude stuff, so
No,
maybe
I
they're.
think you're right. I think you're right. I think it's just starting to get out there. Because listen though, think about it. How much do we really hear from women of a certain age or past a certain age? We really don't. We get very hot women who, Jane Fonda, Helen Mirren. Oh my God, they're amazing. Who doesn't want to be them when they were 20, let alone when they're 80? But and at least they are being celebrated to some extent, but it's still all about their beauty. Now, those particular women have way more going for them, and they're very opinionated, and they are activists in many ways, but we get valued for the way we look. We are scary for the way we sound, and we get silenced at a certain age. My feeling about that is, and you may or may not, now you're going to start paying attention. Now your phone's going to light up because we're having the conversation, and you're going to get all sorts of shit on there that you never imagined, which is great. I can't wait to hear from you in a month, what you're finding out. But, you may have heard about this, like, kind of no fucks to give 50s. It's like a joke, not a joke, because you just kind of cease to care. I'm like, okay, I'll be over here if you'd like to hear what I have to say. I have 50, 60 years of wisdom. I have a lot to share. So it behooves you to listen to what I have to say. I mean, there's a reason why in every indigenous culture, elders are regarded and respected, and people listen to them. They've been on the planet longer. They know some things. They've been humbled. They know what they don't know. They know what they do know. They're empathic, on and on and on. There's a thing called the grandmother effect. In species that have grandmothers, there is better survival. I'm really like boiling it down. Grandmothers are helpful, so but I also am like, I'm not invested in what I think you think of me anymore. I really don't care. You think I'm pretty? You don't think I'm pretty? I don't give a shit. I'm fine. I'm
Yeah.
over here.
Yeah.
Cool. Good luck to you. That's how I feel.
Right.
So, but I mean, there has been a visibility issue. So what I'm saying is I reject the invisibility narrative. I have a lot of people who come to me who either come as patients or come to my menopause boot camps who feel bereft. They feel they are grieving. They feel like nothing. They feel rejected. They feel invisible in a bad way. I have a different personality. I have so much compassion for that. And I really want to help reverse that. I mean, that's why I talk about these things. And it's so thrilling to me to talk to somebody from outside of that community, because it's important for us to understand each other and hear each other and celebrate those stories, and then work together, because you have something to offer me, I have something to offer you. I mean, it's just like what humans are supposed to be doing, as opposed to this whole silencing each other thing. But
Yeah.
to be and to feel silenced because you are a specific age, that's just a tragedy for everybody.
Yeah. Okay. Now back to diets. The
Yes,
last,
I know we got all over the place.
we did, but it was
It's
utterly
interesting.
fascinating. Yeah,
Yeah.
because I have been torn a little bit, going like, it's going to be great when we don't have to deal with this period thing anymore. So I'm like, I wouldn't say that to my wife, because I don't want her to think like, I don't know how. Honestly, we've never really talked about that.
I
Um,
I recommend you ask her.
well, yeah, but I'm thinking like, once this period thing is over, it's going to be great. But then now you're telling me like there's no more estrogen, there's no more progesterone, and like, and I'm suddenly like scared. And 12, it could be 12 years before we even get there, and like the whole thing is
But there's
terrifying.
things you can, no, please don't. But there's things you can do. Remember, I did say there are solutions.
Yes.
There's a wide variety, and I think the issue becomes making sure that you're educated and you're partnering with doctors and providers who are knowledgeable, because not all are. Having said that, yeah, let's dive into
Okay.
that. Yeah.
So the last thing I read, which talked about age and metabolism, but I believe it was a study entirely on men, was talking about how there's no real reduction in metabolism. What
Right.
happens is you have an atrophy of lean muscle mass, which then just lowers your metabolism.
Right.
But the metabolism itself, if countered with holding on to lean tissue, will basically be function the same way. Is that also true for women?
Well, I mean, actually, I think that really big study came out sometime in the last year, right? And I think
Yeah.
I was like, what? And I think women were included in that study.
Okay.
And I will say that I feel like it's not the whole story. I mean, like I said, like I have my sample size of one. It's really a larger sample size than that, because it's all the women I work with. And it's like a lot of us are out there working really hard on resistance training, weightlifting, keeping our body mass up. And I think that I don't think that's telling the whole story. I think, as I sort of alluded to, there's a couple of things that happen because of our specific hormone losses. It's harder to build, and that's true for men and women, right? Because we're all losing testosterone. Estrogen's impact, I think, is being excluded there. And then the other thing that changes when you're decreasing the estrogen at the same time as the testosterone is you have a change in body shape. So, I'm sure we get this middle that we did not have. We get more of like a male body type. And so maybe you even weigh the same, but your body shape changes. So, and then of course, visceral fat is going to increase insulin resistance and inflammation. That is with men and women. So, I mean, who am I to dispute this study? But I have questions about that study specifically, because a lot of us in the field were like, what, and I didn't do a deep dive, and I can't tell you, but I don't know that they looked at like what age you're going through menopause. Are you on hormone replacement therapy or not? Because I think that there are going to be differences probably in the results that you encounter there.
Right. Yeah, and the very few women I have talked to who are older gals have all said everything has become harder.
Yep.
losing weight, going to the
Yep.
gym, it's all harder. So
Well,
that to me says
the other
something.
thing that I want to say, and a lot of women, sleep disruption, as you know, is a huge, huge issue for weight loss, right?
Yeah.
Because if you are not sleeping well, your cortisol is up, so you're going to hang, right? Your body thinks you're in fight or flight, like, oh, I better hang on to that fat. May need it later. It's like, well, no, that's actually not true. I just really want to sleep. So if you have and yes, all humans have sleep disruption as they age, but women have a very special thing, which for a lot of us is hot flashes and night sweats, which keep us up, and not just keep us up, but every time you're having that, it's like a little mini fight or flight response. So you can't tell me that that doesn't affect people's capacity to burn and to maintain that lean body mass. It just doesn't even make sense physiologic to me. I'm not a research scientist. Maybe somebody out there can pull some studies and show them to me, or they can do them, because it has a huge impact. It has a huge impact. One of the things that I have heard, so this is anecdotal, I have a really good friend who is board certified in nutritional medicine. So she's an MD, and she's double board certified. There are maybe 200 doctors in the US who are board certified in both. She's an expert in weight management. And she has always said to me, Suzanne, with my patients, once they are done, once they're postmenopausal and they're not having the fluctuations, they actually do a lot better.
Really?
Because part of the problem here is you're constantly chasing your tail, and it isn't every 28 days with a nice smooth curve. Remember, I don't know if you remember, middle school health class, that thing.
Yeah.
It's it's crazy town. You're constantly chasing your tail. And
yeah, I mean, listen, so I know
hard.
I haven't gotten as detailed with any of my kids on this, but I know for my wife, because we've dieted together, and she's in the last 6 or 7 years, she's gone to do some of these, and she doesn't really need to, but she likes to do like these real crash diets.
Yeah.
And I have had to really go like, please, you can't, this is the cycle. You're going to do this. You're going to do this again every year. Let's stop doing that, which she has. And so she's not really doing that anymore. But I will say, there will come a point where no matter how strict she is on a diet, her period she'll gain weight.
Yeah,
And
totally.
so that's something. I don't know what that means.
Well, some of it is probably just water retention, but I think that your
Yeah,
metabolic rate changes during different parts of your cycle. And we know that like energy expenditure, but also like fatigue will peak the second half of the cycle. And a lot of us will counsel our patients, like, go easy the second half of the cycle, because the other thing here, and this is the thing that is really important as we're aging too, with your workouts, like if you're going hard all the time, you're going to get injured. You need active recovery, and you're again going to release cortisol. You're not going to lose weight. You're going
yeah,
to hang on to the weight. Your body is like, whoa, we got, this is not good. So these things change for men and women, but for women in particular, we just seem to be more sensitive. I mean, I think, if I were to give tips, it's portion size. Portion size is really a big deal. I will say that I think the science is on the side of sort of a modified intermittent fasting. And I feel like using any terminology becomes problematic. Listen, the data on actual fasting is really interesting for longevity. That's not what I'm talking about. I'm talking about like these narrow windows. I mean, obviously, if you narrow your window of eating to 4 hours, you're not eating as much, so that's obviously what some of it. And I think the data has started to show that some of this is just calorie reduction.
right.
But I think for insulin resistance, there's probably something to be said for maybe an 8-hour window. I will also say, if you are forcing yourself really hard and you're starving, that's just not a good thing. If
Yeah,
you're in a transition and you're like, whoa, do I really need to eat that plate? Maybe I really could eat that plate. Like, that's going to take you a little minute to get used to. That's not the same thing. If you're just like starving, no, that's not what you're supposed to do. That's not good for you. So those are some things: protein, 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 protein. You have a fancy scale, but I think something I've talked to my boyfriend about this, who's more expert, because he can size somebody up, and he's like, depending on the person's size and exercise, 0.5 gram to 1.5 grams, right, of protein of lean body mass. So you can quick and dirty it. Food combining is super interesting to me right now. And even there's some data showing the order in which you eat. So your greens, your fibrous, then your protein, then your carb.
Really?
I think these, yeah, again, not an expert. I'm starting to look into this. Can I tell you, this is what's always motivated me, is a combination of what my patients are bringing to me and what I'm going through.
Yeah.
So at 56, my cholesterol shot up 75 points during COVID. Now, was it the stress? Is it that I'm closer to menopause? I don't know. I was like,
but nothing really changed dramatically in your diet?
I wasn't eating so great, but I was drinking a lot. But I mean, that's a huge jump. And I was like, what the fuck?
Yeah.
You know, and also I had gestational diabetes. So I want to say to your folks who have been pregnant, if you had gestational diabetes while you were pregnant, if you had any kind of blood pressure issue while you were pregnant, those risk factors are much bigger for you specifically as you get toward menopause. It's so important. People come to me every day, well, my grandma had this and my dad had that, but their diet is bad, they're obese, they're smokers. And I'm like, hold up, those might be true, but that's actually your family history. So I know I'm all over the place, but people don't always understand what their own risk factors are. So I knew what my risk factors were. I had gestational diabetes, I have high cholesterol in the family, but I was shocked by those numbers. So I've really been doing a deep dive on myself. I'm doing the trend. I'm wearing but I mean, it's for a reason, because I was like getting close to pre-diabetes.
I want to just say that my last kid was born 16 years ago. And so I don't remember ever doing anything at home to check for gestational diabetes. I don't really remember.
She would have done it with her OB.
Yeah, okay, but my kid who just had a baby, there were all kinds of monitoring at home that she was doing. So she didn't have gestational diabetes, and it might have just been because COVID, they wanted stuff less doctor's visits, but she was like keeping track of her blood sugar at home for a few days, and then she didn't have it. But anyway.
But it also might have been, so here's the thing. If she did the first screening test, we actually give people 100 grams of glucola on an empty stomach, and then we check their blood an hour later, right? If she had an elevated number or close to elevated, maybe that was their quick and dirty on it. I don't know. That's interesting.
Well, no, but my question more is, I had no idea that I thought it was something that only occurred during pregnancy, but you're saying that can come back and be another issue.
You failed the test. The best stress test, I mean, depending on how you look at it, ever. That person has a 50% greater risk of developing diabetes later in life. And you can change that risk because you know it. So you can change the way you live your life from that time on. And you can be more aware. Can I tell you where I learned the most about nutrition in my entire medical education? My own gestational diabetes as a resident.
Right.
Because I was like, oh, wait, higher fat, lower carb, had no idea. Thank you.
Yeah.
Oh, when I eat that, this is what happens, because I had to check my blood sugar. So, yeah, pregnancy is intense and it stresses your body. I mean, I hate to term it this way, but I mean, if you fail by having preeclampsia or even gestational hypertension, which is sort of a milder form, or you have gestational diabetes, you just got told your risk is higher, and you need to take it seriously, not to be scary. This is a huge opportunity.
Right. I mean, it's so much to think about. It's wild. So
if we listen to our bodies, they'll tell us stuff.
Yeah, no, totally. You know, I'm not one size fits all human beings, because I do think like different people live their lives very differently from me. However, I think as Americans, we probably on average overconsume anything more than we need to, possibly. And so that cutting back on that would probably benefit many people. And then exercise, to me, is just I enjoy it, and everybody I know who exercise seems to be happier after they
Yeah.
exercise. So like, if
Yeah.
anybody asks me what's the one thing you would suggest, I go like, that's what I think. It's very hard for a lot of people to figure out making that a part of their life.
Oh, yeah. Or maybe even making the time,
Yeah.
and I think the other thing that I see too is that as we get older, we really have to incorporate resistance and weights. We have to. And so if you've never done that before, I don't think it's hard to do that on your own. Not everybody's going to have the resources to have a personal trainer. I mean, come on. Excuse me. But online can be a great benefit to people. I think people have to be careful about injury, but cardio is great for cardio is great for your heart.
Yeah.
It's not weight loss.
Right.
And when you're 20, you can do anything and lose weight, basically. When you're 50, it's cardio got to do it, but you're not gonna lose weight from cardio. I mean, unless you're like 100% sedentary, it's not gonna be enough.
Yeah.
It's not gonna be enough.
Well, I think for women too, that there's a lack of emphasis put on resistance training, because there's some like idea, like when you look at female bodybuilders, it's like,
Right.
well, we're going to turn into that, and I don't want to turn into that. And it's like, what that lady has been doing for years and years and years. And like, lifting weights doesn't mean that you have to have a giant muscular chest. You know what I mean? Like this is not the case.
No. And it's really, I mean, it's so important. And I think you're right. I mean, just the psychological benefit you get, the confidence you get. You don't have to be Olympic lifting.
Right.
You can be wearing 3-pound ankle weights on your walk. I mean, like it doesn't have to be complicated, but we're afraid of changing. And again, like, look, everybody doesn't have the time to invest in this, but we have to try to make it easier, because it's literally saving your life.
Yeah. Okay. So for gals in, I think about this perimenopausal thing, like as you said, postmenopausal, everything evens out, and you can get into some routine and figure out stuff that works.
Yeah.
What is your recommendation for that potential 12-year cycle that you have your body throwing curveballs at you randomly?
It's very humbling. Be patient, be gentle, and find a partner in your healthcare who understands it, who can help you navigate it, because it is going to be changing. It's not impossible. The one thing I will say about people is they are a lot more resilient than you might imagine. You've been through a lot. You've been through huge changes in your life.
Sure.
You had support, you had mental fortitude, you did things that, created confidence. Everything wasn't like a straight line for your weight loss. So, I think I think having that community and that support around you makes a big difference. Not feeling so alone, saying the word out loud, being able to have a menopause boot camp community. You have a tribe that you find, and you realize it's not just you. And just being nice to yourself, because there's nothing in life that's going to be a straight line, a straight path to success. Like the path winds all over the place. I think the other thing for a lot of us is, if we've lived through the menstrual life, like we know how to navigate change. We may know how to navigate the curveballs a lot better than we might imagine. So I think just remembering that we can do stuff that isn't easy. Like, nobody said it's all going to be easy. Doing it alone is really hard. That is not okay. So doing it in silence, without information or resources or support, is impossible. Like, nobody should be expected to do anything in a vacuum like that. You're never going to be successful, and you're never going to be able to celebrate your successes if you're doing it alone too. So I think us having the conversation and putting the information out there first and foremost just normalizes it. There's somebody listening to this who's going to be like you, like, oh my God, I had no idea.
Yeah.
And oh my God, I had no idea that these are things that I could do.
Right. And I'm super interested in like how to better assist my wife when this does come up, because like, honestly, my life is much better when her life is much better. You know what I mean? So like, I want her to be doing as well as possible. and it's all very interesting to me. I hope we get one of those hers company. It becomes bigger. You know, I don't see why it shouldn't be.
It will, because people are demanding better.
Yeah. Yeah.
I mean, it really things don't change from the top down. You know that.
Right.
That's not how that works.
We
They
need
like to they tell us that, but that's really not how it works. I mean,
Mm.
when we make demands and we put our money where our mouth is, things change.
Yeah.
That's it. That's just the way it is. That's how life is. And that's okay, because it gives us an opportunity to use our voices, or to
Yeah.
find people who feel comfortable like you using your voice. It's super important. What you're doing is so important to educate people.
Yeah, and I mean, I hope it's not only important to me because I have only daughters and a granddaughter, you know what I mean? Like, I hope it's important to me because I have a wife, you know, and because I'm a human being, because I
Right,
think
because
these
you're a
things are
human being,
important.
because half the planet, actually a little bit more than half the planet, is populated by people who are affected by this. I mean, we're all affected by this. And I think the other thing to remember here is, like, it doesn't have to be a disaster. Like, it's just a change.
Yeah. That's it. Yeah, no, it's
Yeah.
a change, and we're all changing. We're constantly changing, as you said.
Mhm.
Every day is a step towards this. Like, you
Yep.
know,
Yep.
the cycle of life is happening. It's a cycle.
Exactly. Exactly.
Yeah.
Exactly. Yeah.
Amazing. Well, thank you so much. This has been an amazing conversation. I can't wait to get your book,
Oh, thank you.
Pause
Yeah.
Boot Camp, right?
Yes. Yes.
Yeah.
Yes. Out in October. Very exciting.
Yeah. My wife is gonna love it. Thank you.
Oh, it was so great.
Good
Yes.
talking to you.
Yeah. I'm so sorry. Then I
No,
don't know
it's
what's going on
okay.
here today.
It's
All right.
okay. Okay, see
All
you
right. Take
later.
it easy. Have a great
Thank
one.
you.
Thanks for
You
your
too.
time.
Bye.
Bye.